All right, well, thank you everyone for your patience. I think we can get started with the webinar now. We're actually thrilled to be broadcasting live from the Priorities in Perinatal Care conference in South Africa right now. And we are obviously thrilled to have Standwa, who is a specialist midwife and NASG expert, here with us to take your questions and offer any information and insights that she has into the NASG as well. But before we do that, I just want to introduce everyone to the webinar. So this is the VIA Live Product Training Webinar Series. And what we like to do is feature some of our most innovative and new products to help inform the market and allow you to learn about new products that you can then introduce to help your business, but also to the health outcomes in your communities. So the first thing we like to do is just introduce VIA Global Health for those of you that are not familiar with us. So what we are is a medical sourcing platform that allows you to source, quote, purchase, and ship from products no matter where you are in the world or where the products come from. So we're connecting the manufacturers and the local distributors and end users to the best innovations in the world and keeping that faster, easier, and more affordable for you to source those products. So again, we like to feature our most innovative products in these webinars, but we do have thousands of products, including your basic devices and even moving into some general consumables and disposable equipment as well. So if you want to learn more about VIA Global Health, you can go to our website, just viaglobalhealth.com. You can see on our homepage, we have everything you could ever need, from product information to training to different location details. If you want to learn more about us, you can go to our company section. You can go to the About VIA section here, and you can learn about our mission, our goals, what we're looking to do as a company, and our objectives. You can learn about where we're located. You can watch videos about us. You can see different partners and publications that we've worked with. You can see some of our latest company news. And you can also look at things like our Market Insights program, our VIA Rewards program, where you earn every time you interact with VIA. You can look at the product training videos, which is where this webinar will actually be housed after we record everything. You can look at some of our testimonials from customers and generally just more information about our team as well, if you're interested in learning more. So some of the ways we help you to source products and purchase and ship and quote is to make all information available. So there's a few ways you can obviously interact with the site. You can search much as you would with something like Google. So if you're looking for an ultrasound, for example, you can type that in there. And what that will do is give you recommendations for any product with ultrasound in the title or in their description. You can obviously just click that search and it would bring those up in more of a visual format. Again, for the purpose of what we're going through today, we're going to introduce the non-pneumatic anti-shock garment. So if you wanted to search here for NASG, it would come up here and you'd click that, and that would take you to the product page, which is really just your brochure. And we'll go through that in a moment. What you can also do is use our categories. So if you know you're going to meet with a neonatologist or a pediatrician or an obstetrician and you want to see what products we have that would be relevant for them, you can just click here on that maternal and newborn health category. And what that would do is bring you to this page, which is all of our catalog of the different products that would fit into the maternal and newborn health category. So you'll see it's about 101 products there, everything from phototherapy bed to CPAP, to the anti-shock garment, to Dopplers, fetal monitors, maternal fetal monitors, thermocoagulator for treatment of cervical cancer lesions, and really anything from there. You can view more products. So we're trying to make it as comprehensive to give you all the products you could possibly need and to organize it to help you find the products you're looking for more easily. So going back to our homepage, the last way I would say you would want to focus on finding products, and if you're looking for something new to the market, something innovative, something that's not yet been introduced, and it's actually being developed specifically for the purposes of lower resource areas that maybe doesn't require power or doesn't require wall oxygen, certain innovations that are making the more traditional devices more attainable. That's where we put them here in our featured products. So you'll see different products here that might be new to you. The first one we want to feature here today, obviously, is the non-pneumatic anti-shock garment, the LifeWrap non-pneumatic anti-shock garment. And this is one of our most popular products, and we're starting to see heavy investment in South Africa and the region now with this product as well. And we can talk more about that. So what we're trying to do here is give you the information you need. So if we click that, that would take you over to the product page, which is where you can find all the information you could possibly need about this product. So we know for your inquiries and your private inquiries, but also government tenders. You need pictures of the products, so you can click through and see everything here. You can see them in the environment, but you can also see some diagrams that are more explanative to what you're looking for. You can see short descriptions of the product, the regulatory approvals. You can see different testimonials from users, and we'll obviously have more of that from Standwa as we go through this webinar. More of a description of what the product has done, clinical trials and research that has been done, as well as sizing information, frequently asked questions, and then videos. So again, once we finish this video today, we'll upload that here so you can use that for your training, for your sales pitches, everything there. A little bit more here for product documents. We know that you need brochures, you need sizing guides, specifications, manuals, everything here at that point. So again, warranty information is very important. So you see here it's 2 years manufacturing, and this is actually one of the, we'll say the only product that's the NASG that's tested with a use of 144 uses before it needs to be replaced. There's no other NASG in the world that has that certification. If you're interested in requesting a quote to learn more, to purchase, you can click that and fill out your information and submit that, and we'll come back to you. Obviously, if you're one of our verified distributors, you would have access to the pricing when you log in, and you can make the purchase directly here on the website. So that's everything here. The idea for our product page is to make all of the information immediately accessible to you so that you can find all the details you want without wasting time and energy to find the information and wait for answers. It's all about being fast, easy, and then ultimately affordable for you to buy this product that can help the health outcomes in your community. So with that, I would like to hand it over to our featured guest here today. We're proud to host Standwa, who is a specialist midwife in KZN in South Africa and our NASG expert. And again, we are broadcasting live from the Priorities in Perinatal Care Conference in South Africa. So we do apologize if there's a little bit of background noise, but it's one of the most relevant places we can actually take you through the product because we're here with industry experts to talk through the benefits, the results, and really how we can help get this product into more clinical environments.
Like you said, Brian, hi to everyone. I'm Standwa Mngai. The nurse, and I have done midwifery and also postgraduate diploma in advanced midwifery and neonatal nursing, which I did in 2002, 2003. And since then, I've been working in various levels of Department of Health and also for non-profit organizations, and from primary health care, where I was assisting other midwives to improve their clinical skills. And currently, I'm employed as part of the district clinical specialist team as a midwife in that team, where we are responsible as a team for clinical governance and improving maternal and child care at a district level, facility to facility. So my day-to-day responsibilities is to be at the facility where I would support other midwives in improving their clinical skills and doing clinical audits to identify if there are any gaps that we can actually address in improving the quality of care that they're actually providing. Because we also are responsible for sort of formal research. So I've actually done masters in public health, and I'm actually pursuing a PhD in public health as well. So that's basically what I actually do. But the other thing, I'm also part of the committee that assesses maternal deaths in KZN, which then those assessments, they then informed the national committee into confidential inquiry into maternal deaths in the country, where every year and every 3 years the Saving Mothers report gets produced from the way that we do in assessing all the maternal deaths that get notified in our province. Yeah.
Excellent. And how long have you been working with the NASG?
We started in late June 2018, where Professor Focus and Dr. Moran they both are in the National Committee on Confidential Inquiry into Maternal Deaths. So they were actually commissioned by the National Department of Health to actually start training in our region. Our region in KZN is called Region 4. It's got 3 districts, of which my district, Prince Edgwayo, receives referrals from the other 2 districts. So the NASC has been implemented in these 3 districts that has got 16 district hospitals and 1 regional hospital, which is located in my district. So after being trained, the 38 NASC then were distributed to each district hospital, each of the 16 district hospitals, and some primary health care facilities and ambulance services, especially those that are responsible for obstetric, are called obstetric units. And since then, I've been involved in actually providing training on the use of the NASC, and whenever there were patients also in the regional hospital that would arrive with the NASC, I would then be part sometimes of the management of those patients. But also, if I were in one of my district hospitals, supporting them, and there was a need for a patient to be put on the NASC, either locally or being transferred to a regional hospital. So that's what I will be involved in, as sort of teaching and making sure that they apply it correctly and for the purpose of saving the life of that woman. So since June 2018 till today, we've been implementing it as part of the management of PPH, postpartum hemorrhage. So it's not an isolated intervention. So it's an intervention that has been introduced within other interventions to the management of PPH.
Excellent. And it would be great if you would be able to do a demonstration. And as you're doing the demonstration, if you can talk a bit about the symptoms that you see in a patient and when you would start to introduce this intervention, just as if you were treating the mannequin as a typical patient.
That's not a problem. I can do it. I actually have my colleague who will be assisting me in applying the NASC.
Wonderful.
Okay. So basically, I'll be having a patient that has been bleeding, and as part of the management, we would like to apply the NASC. And like I said, it's not an intervention that is provided in isolation. Other management interventions are necessary. We usually prefer, while other people are like putting up IV lines, that becomes part of what we do initially, so that we are going to sustain this woman in terms of not dropping the blood pressure and also not having an increased pulse, because those are mostly the 2 that get affected when the woman is bleeding. In that, then hypothermic shock will be or with the breast if it's already there. So we are going to start with step number 1. I'm not sure if you can see it, but this is step number 1, and my colleague is going to help me. If you really are alone, you can try and apply it by yourself by trying to get step from this side and to the other leg. But it usually helps to get somebody to help you to apply it, even if it's not a highly skilled professional person, as long as that person, you will be able to actually show how it's done and what to do. So we are going to start with applying step number 1. I'm on the left leg and colleague will be on the right leg. So we start applying number 1. We will put it as tight as possible because it does not work as a tourniquet. It does not sort of restrain. To check whether it is applied properly, you just snap it. Once you get that click sign, then you know that it's applied properly. And then you go to step number 2 without blocking the knee, because you might need it later when the woman needs to move. So step number 2. And then also to test whether it's properly, then once you get that click sound, then you know that it's applied properly. Then you get to number 3. Number 3 has to be above the knee, so that you make sure that you don't block the knee. Because the door, not that you will get the knee to be free. And then we come to number 4. Number 4, which is at the pelvic area. At the pelvic area. The side, then we come to the lower abdominal part, which is our number 5. Our number 5 has got a little bit of a hard, sort of a soft ball that has to go over the umbilicus. It going over the umbilicus, it will help provide some sort of compression over the uterus so that it gets contracted and it remains contracted. So that will be our step number 5, and then colleague is going to give me the part of number 6, and then I will then start. So the nurse is actually fully applied. The reason we were saying that the knees needs to be exposed is because since this woman is exposed and the knees are exposed, whenever we need to do any procedures like doing a vaginal examination, this part is actually available for us to do it. And then also this part, if we need to do any sort of procedures, it could be taking the patient back to theater, do whatever, this part can be exposed while the other part of the mask over the legs remains on for the time. And what I didn't mention is that some patients may be short. If you're dealing with a woman that is short, you will not use step number 1. At the application initially, it will be folded over number 2. So because the women's size in terms of the length of the women, it might not be the same, so we can fold it. So then the last case up will remain on the whole time that you're waiting for other life-saving interventions until the ambulance arrives. If the patient needs to be transferred to a higher level of care, and then it will not be removed until precaution is taken care of in terms of making sure that the woman is stable in terms of the normal blood pressure and normal pulse rate. And also the hemoglobin levels, all that, and make sure that the woman is no longer bleeding. So you are satisfied that the women will not go into a shock as you. And it can stay up to about 3 days, but there is no specific rule. the patient is to be stable before you consider I can go into actually removal as well.
Yes, if you could show the removal.
Then the removal will go back and start at number 1. Cholera is going to continue affecting me. So we are going to remove step number 1. And after removing step number 1, we are going to wait for 15 minutes. And what are we doing in the 15 minutes? With that 15 minutes, we'll be checking the blood pressure and the pulse rate. If the blood pressure remains the same, it doesn't drop. And what will be worrying is the drop that will be of the systolic blood pressure, the drop of 20 or more will be worrying. It means that we have to strap it back. But if the drop is not more than 20, and the increase in the pulse rate is not more than 20, then we'll be compatible then after 15 minutes to move into the second step number 2. And also we wait for another 15 minutes, we check the pulse and the blood pressure. If the systolic blood pressure doesn't drop to more than 20, and the pulse doesn't increase to more than 20, we then continue to step number 3 after 15 minutes. We wait for another 15 minutes. The drop is not more than 20 for the blood pressure, and increase pulse is not more than 20, then we move to number 4. Also wait another 15 minutes, and then we remove the mask. And then after the mask has been removed, make sure that your patient is compatible. You take out the mask, and then you soak it, and then prepare it for cleaning. And cleaning is just using the bleach solution, depending on what solution you use. When you buy it, you will have a guide that guides you as to what type of bleach with what types you put the strength that you use. And then after washing and so forth, then you can hang it to dry for the use.
Excellent, thank you. So we have quite a few questions that have come in, so I think we can probably have you return to the desk for that. And I'll try to moderate those questions so that we're not being redundant with some of the questions. So thank you for the demonstration. There was quite a few people that were asking about how it's applied, how it's taken off, so that answers quite a few of the questions. The first question really is just about, it sounds like you've been working with the NASG for almost 1 year. So people want to know what your findings are. What's been the result of working with the NASG for health outcomes?
I might have said earlier when I started that the region where this NASG is implemented, there is 16 hospitals that are referring to one regional hospital. And if we're talking about 16, we're not just talking 16 within a close by, or the furthest hospital will be about 270 kilometers away, and the travel time it will be 4 hours or so, because some hospitals you get through the gravel road to get to them. And the other challenge is the availability of ambulances. There will be a delay because we have a shortage of sometimes ambulances. So while the woman is being managed, and in the management we include the NASG. So the NASG has shown to actually assist in maintaining a normal blood pressure. If there was a low blood pressure when the woman started bleeding, as soon as the NASG is applied, the blood pressure then starts to increase and the pulse rate starts to decrease. So during that time when either they are waiting for the ambulance or stabilizing while stabilizing the patient, if it's used, then it assists in preventing shock or reversing shock, maintaining blood pressure, and then pulse rate, so such that during then transit, the patient will be stable.
Excellent. And do you have any case studies that you'd be willing to share about any patients and their stories of using the NASC and the positive outcome it provided?
Because when we started 2018, end of June, we started receiving, after the training, we started receiving the patient with the NASC about the 26th of June 2018, and up to on Monday when I left KZN to the conference, it had been used. The ones that have been recorded were 56 patients. Of the 56 patients, 50 were applied the NASC in their district hospital and were transferred to the regional hospital in our district. And of all the 56 patients, because the 5 were then done in their own hospitals, NASC applied, and then the patient was managed there, and there was no need for that patient to actually come to the regional hospital. And some of these patients is the patients that when the bleeding was identified, the hemoglobin levels would be as low as 3 grams per liter. So those are the patients that incorporating the NASC and the management of PPH, we've been able to save. Of all the 56 patients, we were able to save all of them. And then within the regional hospital, they are a very busy regional hospital, and sometimes even while waiting for the theatre to be available to explore all the issues about the bleeding patient. There was one patient where the NASC was used while waiting for it to be available for further management. So that's how the NASC has contributed in actually saving the lives of women in our region since we started.
Wow, so every patient that's used the NASC in your trial has survived?
Yes, there were also concerns about the, did you see that step number 6, the one that has got a hard sort of softball that is applied over the umbilical region. It's very useful in actually maintaining the uterus contracted all the time that the patient is being transferred. However, not in a bad way. It has nothing to do with the garment itself, but the patients, they would experience a pain if it was a post-cesarean section patient. What we need to be careful about is how do we make sure that we provide pain management for this patient while we want to achieve a contracted uterus, so it's just that the woman does not experience a lot of pain. So that's what one of the lessons that we have learned in terms of post-cesarean section patients, that we have to be mindful of pain over the umbilical region.
Excellent. And of the patients that you've used the NASC with, if there was not a NASC available, what would be the typical survival rate for the mothers?
Actually, after the NASC was introduced in June, we have had we have known about a few missed opportunities where healthcare workers in that district hospital either were not aware of the NASC or the NASC, or they actually how to use it. In 2 occasions, because the staff were not aware of the NASC, we lost 2 mothers, 2 maternal deaths. However, we also at a regional hospital received I think about 4 patients that came without a NASC. However, their lives were saved. The difference would have been the resources that you need then to actually provide for them, because the condition that they will arrive in will be different than when a woman arrives with the NASC. The blood loss would have been a little bit more when women that would not have come with the NASC, or there was a delay in applying the NASC. So in terms of the reported cases that we know about where the NASC was not used, much as they survived, the resources that then were needed for them would have been a little bit more than the ones that would come with the NASC, or the NASC was applied earlier.
Excellent. And I know you've mentioned a few times about training, or in some facilities there's not training that had been done. So how do you train different providers for how to use the NASC? What's your process?
In KZN, generally, we run the ESMO-E trainings, which is the essential steps in the management of obstetric emergencies. That program has been running for quite some time. And one of the obstetric emergencies that is part of those trainings, and also fire drilling those, is the management of bleeding, either before delivery or post-delivery. So when the training was for the NASC was introduced in June 2018 last year, it was not just a NASC training, it was a comprehensive PPH training that included when and how then the NASC will be incorporated as one of the interventions in the management of PPH. And the ESMO-E has got master trainers. At least there will be 2 master trainers per hospital or per delivery unit, except for the regional hospital, where there will be at least more than 2. And those then gets responsible for ongoing training for others. And the training strategy will be actually to have case studies and having fire drills, putting up scenarios as to what if the patient comes with these symptoms, how would then manage it. So then in the management, the team that will be managing that emergency will then incorporate the application of the NASC until the removal. So that will be done in a sort of a fire drill, the scenario type case.
Excellent. And it seems like the demonstration of the NASC, just like you did a moment ago, would be enough for most providers to understand how to apply and how to remove the NASC. It's as simple as that with most providers?
It was just simple as that. And the providers that were part of the training and actually experienced putting it in, they were very happy that it's nothing different than when it was applied. And what was an advantage, I think, we did not have the model that I was using. So we had volunteers, like human volunteers, as part of the training, who actually volunteered for the NASC to be applied on them. So it incorporated more live person, even though the person could move and was not shocked, but using that kind of who can bend the knees and who can do that. So that's how we were doing we are actually doing the fire drills. So I think that helps, so that people are able then to go back and after the training apply it, and we have not seen any problems with that.
Excellent, that's perfect. And there's a question just about knowing when you should apply the NASC. Is there a certain symptom or a measurement that is your indicator for when you should be applying the NASC?
Personally, I would advise that as soon as you realize that the woman was bleeding, or you suspect that the woman is bleeding, or the bleeding is more than a normal bleeding, if you start applying it and then do the other management, I think that can actually prevent shock much earlier, other than trying to reverse it and trying to do other things. However, as soon as you realize that there's a problem, then it needs to be applied. There are some cases where it was applied a little bit too late when the blood pressure was about 70 over 40 something, even though we think that it might have been too late where the HB was about 3, but still applying it then assisted in reversing shock and also actually reducing the bleeding because of how it works. Then it will channel the circulating blood to the brain and the vital organs like the heart and the brain. As soon as you apply it, if that actually mechanism start happening, then there will be less bleeding, which then will sustain this woman. So the earlier the better, but even if you think it's too late, applying it at any point, it will have some benefit.
That's perfect. And there's quite a few participants on the line that are very interested in the NASG, but they haven't used it yet. So they're asking you if you have any advice for them for either using the NASG or convincing their local clinics or government to incorporate the NASG into their medical procedures. So is there anything you've had success with in helping to introduce the product that's with people that are not aware of what it does?
I think the WHO, the World Health Organization, has already actually encouraged people to start using it. And in the South African context, it's already incorporated into the PPH management protocol. So I'm sure in other countries, if they can, they can already. And also, in challenging resources, I think it's not. It's a simple technology, if I can use that word. It's a simple technology that even if you are at a community level, you can, and then you don't have to then need much more resources, because in the absence of the NASG and the woman continues to bleed, it means by the time this woman needs help, gets to where she can get help, like a specialized a facility or hospital, she is likely to need more blood. And we know that in most African countries, including South Africa, we really do have a shortage of blood. And also access to a specialized consultant like obstetrician, we don't normally have access easily to those resources. So we can save those little resources by just applying this as that will the complications with I said earlier that it's to prevent volemic shock than to try and treat it, because sometimes we might not have enough resources to actually do so, or getting to a facility where that can be done might be a challenge as well if you are a low resource setting.
That's excellent. So there's only really one main last question. A lot of our participants are understanding the impact of the NASG, but they're asking if you could describe this in just a few words, the impact of the NASG. How would you describe the impact that this product has had on your patients?
It's life-saving in the sense that it gives you time to be thinking about where you are going to get blood, where you are going to get advanced, when you are going to get this patient to theater. So this simple technology will maintain the life of this woman while you are trying to find more advanced resources to actually assist her. So we'll keep her alive. So it's life-saving.
That's perfect. It sounds like exactly what it's been doing for your trial the last year, is it has helped to save the lives of far more mothers than it would have if there not had been a NASG there. Yeah. So that's all the questions. Is there anything that we didn't touch on that you'd like to explain about the NASG or your experience with it?
Since we didn't know how immediately we started using is how would to the toilet who needs a bedpan. So in the latest video that we find in your resources was that we can just remove step number 4, just push a bedpan under this person will release themselves, and then you can then take it out and apply the step number 4 back. And whenever you need to do any examinations, she can be freely be able, when you need to apply pressure onto the uterus using the other technologies, you have access to the private parts of this woman. So it's not restrictive. So it's assisting you, but it won't restrict you in whatever else you need to do for this woman.
Excellent. And so there's quite a few questions that I'll take actually that people are asking about pricing and orders and shipping and different details like that. So I'll again show the product page. If you do have the interest in making an order or getting a quotation, just come here and click that request a quote. Once you do that, you would submit that order form. You can also email us directly at sales@viaglobalhealth.com. But a few questions as well about things like cleaning. So again, I know Standwa mentioned that, but you have the detail here about storage, about how to store it, about sizing people are asking about. So these are all very clear details on the product page. But as far as any orders, definitely come to us directly through the website, or again, that email is sales@viaglobalhealth.com. But with that's everything we have for the webinar. Standwa, I'd like to really thank you for joining us and taking time out of your day. I know you're actually speaking at the conference tomorrow as well, so I wish you the best of luck with that. And we'll try to have video of that as well so we can share with all of our participants so they can learn a bit more about your trial with the NASG. So thank you very much. It's been extremely helpful, and hopefully this leads to additional NASG in the necessary clinical environments.
Thank you so much, Brian. It's been a pleasure.
Thank you. And for everyone else on the line, thank you for joining the latest VIA Live product trading webinar, and we hope to see you on the next one. Thank you very much.